Okay, so it's my pleasure now to welcome my colleague, Dr. Don Mordecai. Don, a few years ago, was asked to add to his set of responsibilities at Kaiser Permanente, where he was the leader for psychiatry for Kaiser Permanente in Northern California, to take on the role of leading the transformation of mental health and wellness throughout Kaiser Permanente nationally. He's been with Kaiser Permanente since 2003. Gee, Don, this is new stuff for me that I'm learning here. He trained at Stanford University at the School of Medicine in child and adolescent as well as adult psychiatry. So he's got the entire span covered in terms of no matter who you are, Don's your guy. Also worked patients with developmental disorders, ADHD, and the entire range of general psychiatry issues. Particularly interested in working with adolescents and young adults. And of course, in his free time, he continues to teach as an adjunct professor of psychiatry at Stanford's School of Medicine. So Don's going to lead us through our next panel, and I think make a few other remarks about what's going on at Kaiser Permanente.
Yep.
Don, thank you.
Tony, thank you.
Okay.
Good morning, everybody. You feel a little far away, so I may try to be like bigger up here. But I wanted to thank Tony as our government relations host from Kaiser Permanente. I wanted to thank the Center for Total Health, the whole government relations team, and mostly I want to thank all of you who are here on this day to talk about a topic that is obviously near and dear to my heart. But has really become very important to Kaiser Permanente as a whole. We really see mental health and wellness as a central part of our strategy going forward. We like to talk about total health, mind, body, and spirit, and this is really our efforts around the mind, and I would say around the spirit as well. Kaiser Permanente, for those of you who don't know, we're the largest private integrated insurance healthcare company in the country. We have about 11.8 million members. If I wander, is that okay? I'm looking at the AV people. Like, can I? Oh, cool. I feel much better. Conservatively, we do about 4 million plus mental health and addiction care visits a year. So we're a very large provider as well as an insurer that's integrated with our care system for primary care, specialty care, all of that. We think it's a pretty great model and a great way to do both mental health care and all care. We are leading a process to do some important things within mental health. We see that we need to focus both within the specialty care system, but also within the primary care system as well to do integration the way that we can. In terms of specialty care, we're looking at a few things. One is access, right? We believe that access is simply fundamental to getting mental health care right. And in some ways, it is starting to feel like a social justice issue to some extent because, you know, there's national mental health care parity, the ACA is still in effect, and yet if you can't find a mental health provider, if you can't find a child psychiatrist or a child therapist, there's no access, there's no parity there. So we take access extremely seriously. The second thing we're doing is around what we call feedback-informed care, which is to bring measurement-based care into mental health, because we know now that there are ways to measure improvement and what works and what doesn't work in mental health care, and yet mental health care has been lagging as a branch of medical care for a long time in terms of using those kind of measurement-based approaches. So we like to talk about it as if you were measuring blood pressure, right? People can come in for a check, we can do patient-reported outcomes to assess how they're doing, we can use those outcomes with an individual to track progress over time and say, hey, things are getting better, that's great, what are you doing that's working? Or things aren't getting better, right? Your blood pressure is not getting under control. We need to change what we're doing. And then, of course, we can aggregate all that information to say, well, how as a system can we get better? What can we do as a system to take better care of our members? It has helped us learn things like which kinds of visits are most important to people getting better with an episode of major depression? Is it individual therapy visits? Is it group therapy visits? Is it medication management visits? What combination of those visits provides the best outcomes for people? So we're very excited about that. We think that's the way that the whole country's system of mental health care should go, so that we can demonstrate the worth of this very important care that we're providing. And the last thing that we're working on is around suicide prevention. We feel like that is a sort of top-line issue that all care systems need to be paying attention to. We know that the suicide rate after dipping for many years is now on the rise again, that suicide is the second leading cause of death among young people after accidents, and that's just not the way it should be in our society. And we think we can change that. We're doing some exciting predictive analytics work on that that I would love to tell you more about at length, but I will not do that right now. But I may have a chance later if you want to hear more about that. In terms of primary care, we have a project around depression care management where we're trying to really bring impact-like efforts into primary care, because we know that we can take care of a lot of these things further upstream and get people better earlier such that they might not even need to go into specialty mental health care. There's proven models for that, and we feel like if Kaiser Permanente can't do it, nobody can do it. So we're really pushing on that throughout our program. So with that, I mean, you heard a lot from Pete. I really appreciated what he had to say. If you don't leave that feeling disturbed, maybe hopeful too, but disturbed about the way we're dealing with mental health care in our country, that was striking to me. We, of course, see similar issues. We have workforce issues. We know that there aren't enough people to provide mental health care throughout our country. We have fragmentation issues. So even where people are covered, even in our integrated system, some of the people we take care of who are Medicaid funded, they can get mental health care in our system, but addiction care, they have to go back to the counties, right? Doesn't make a lot of sense to us in our integrated system, and a lot of times we see that the counties don't really have the resources to provide that care, so then it really doesn't make sense. And then, of course, there are the resource issues. As Pete said, I think we're simply not spending enough money in the right places to take care of people. It's like as if all of you don't know that, but I think it bears saying. So what I've been asked to do today is to sort of build upon Pete's introduction to continue this theme of how do we give voice to both people, consumers, patients, however you want to call them, who are dealing with mental health issues themselves and their family members. And I'm thrilled, I'll be introducing the panel in a little bit, but along with this theme of giving people voice, Kaiser Permanente has invested quite a bit over the past couple of years in an effort we call Find Your Words. And this is a public health awareness campaign around defeating stigma around mental health issues. I wonder how many people saw the Find Your Words ad with the young African-American boy walking through the streets of Los Angeles? Raise your hands. So a fair number. We actually showed it throughout the country. It's not meant to be a Kaiser Permanente ad, so we didn't just show it in Kaiser Permanente markets. We do happen to be in Atlanta, but it was on during the Super Bowl in the Atlanta market, which I just think is so cool, like an ad about mental health stigma on during the Super Bowl. So we're continuing that effort. This year we have a new public health awareness campaign ad that I'm going to show in just a moment. We've done a large demographically diverse poll looking at mental health attitudes in the United States. Just a few interesting things about that. About 70% of people feel like attitudes about mental health and being open about mental health are getting better. About the same amount of people feel like, you know what, I'm ready to do my part. I want to help people who I think may be struggling with these things. On the negative side, more than half of people felt like depression is at least in part due to personal weakness or failing, which to me is that old, stigma-laden, we got to move past that attitude, because that's the kind of attitude that makes people say, okay, there's something wrong with me. I'm not going to talk about it. I'm not going to raise my hand and get care for it. I'm not going to get better. We can do a lot better than that in our society. So with that, let me show the Find Your Words spot. It's about a 30-second spot. And can we get that up there? Excellent. So just 30 seconds, no faces, no words, but I think really sets a kind of tension about, oh, what's happening with this person? Oh, what's this person going to say? And then, of course, it leaves you hanging. One thing we saw in our poll is that people don't really know what to say to start those conversations. So we put up this ad. If you go to findyourwords.org, which I would encourage you to do, there's lots of great resources about how do you start that conversation, right? How do you seek care if you're an individual struggling? How do you communicate with your loved ones that you think may be struggling? We make connections to our partner organizations, NAMI, Mental Health America, the Crisis Text Line, the Suicide Prevention Hotline, and it's wide open to anybody who goes to the website. So we're pleased with that. And then on the website, we also have StoryCorps. How many people have heard of StoryCorps? We're in DC, so I figure there are a lot of NPR listeners here. So StoryCorps is a project to try and gather America's stories, if you will. And we asked them to gather stories about people interacting with each other who have mental health conditions. And what we wanted to do is show you one of these stories. This is available on the website. A couple pitches for the website. It's mobile enabled, so it looks beautiful on your phones, and it also is in Spanish. And Pete earlier was talking about the importance of resources in other languages. So if we could show the Al Smith video.
As a kid, I had this feeling inside that I never really could put a label on. And one of my first years of college, I was in an English class and existentialism came up. The teacher was describing it. I felt like she was describing how I feel. And I never knew there's a word for this and other people think this too. There's this one quote by Kierkegaard, I think, and basically it said, I went to the party and I was the life of the party and I made everyone laugh and smile and I toasted and talked and then I went home and I wanted to shoot myself. And that was it right there. This is like before Facebook. I think it was on MySpace for my little quote about myself. I said, I love life. I'm soaking it up. I can't learn enough. It's so exciting. And then I can sink into a black hole of despair. Not like I want to kill myself, but I don't want to exist anymore.
Mm-hmm. You're just questioning what's it all worth.
Yeah. It's like hard to get out of bed. And I had panic anxiety disorder where I had trouble breathing. Your heart just starts pounding, pounding, pounding. I felt like I was having a heart attack. So I went to a breathing therapist. And then I tried yoga, I tried acupuncture, and I still was so depressed. And I was just like, I need something. I'm going to get on meds.
When everybody asks, how did we meet, I jokingly say I stalked her, but I certainly don't want to endorse that kind of behavior. But I heard your punk rock all-girl band and finally got the guts to say hi to you. And you asked me to play drums on your zombie band project. So that's kind of where it started. We fell in love by our love of music.
Meeting you and when we started dating was refreshing because when you found out I was on medication for depression, your reaction to that was nice because you told me you were also on medication for ADD. Mm-hmm. And I've never felt pressure from you to get off my medicine or never felt like you judged me for being on meds. And that's just been really nice because in past relationships, I've had people try to say like, oh, well, we'll get you off that, or something like they didn't really understand me.
I've never really judged anyone for anything that they didn't do, or medication they were on, because it's obviously by no fault of their own. So it's hard to fault somebody for trying to help themselves. So I'm glad that you weren't feeling judged by me.
You also went to therapy for a while, as I did, and I think both of us realized that therapy can be a really good thing for people who are struggling. Mm-hmm. I can think of one therapist that literally saved my life. I don't even know if I would be here if it weren't for her.
So now you can enjoy your day on an even keel? How does that feel?
I find a joy in the little things in life, and I just try to be thankful for what I have. There's so many good things you can read and awesome bulletin boards and things. Mm-hmm. People just talking about how they feel. And it is calming to know that you're not alone. You are not alone. And just remember that.
So those are our public-facing efforts around raising mental health awareness and trying to break through the silence and the stigma that we feel like is really holding people back in terms of getting care.